Good morning, and thank you for joining us for today's legislative update regarding employee benefits issues to watch. Our speakers for today are Holly Wall, Vice President of Compliance for Hylant, and James Slotnick, Assistant Vice President of Government Relations at Sun Life. Our webinar is scheduled to last 1 hour with approximately 45 minutes of content and 15 minutes for Q&A. Our webinar is going to be recorded and will be posted to hylant.com later today, as well as the PowerPoint slides. Currently, the slides have been loaded as handouts in the drop-down menu of GoToMeeting, and you should be able to access them there. All phone lines have been muted for today's presentation. If you have questions anytime during today's webinar, please type them into the question box of the GoToMeeting menu, and we will address as many questions as possible at the end. So I will now turn it over to James Slotnick. Oh, wait. I will now turn it over to James Slotnick to begin our presentation.
Sure. Thanks, Lisa. Thank you for joining today. Obviously, just an incredible amount of information is flying around right now. Even as literally as Lisa was talking, I'm going through my Twitter feed. I'm getting texts that it looks like the Senate is very close to an agreement on a third coronavirus the economic package, which we'll talk about later in the presentation, which for those of you that have been waiting for those checks in the mail to come to everyone, or checks to come in the mail to everyone, or been waiting for access to funds from the government, those should be on the way. I'm not sure if I know my screen just kind of tweaked out a little bit with the slides, so I'm not sure if that's everyone. So I'm going to make a little executive decision, just show my screen here. They'll took over the webinar there just to make sure we're seeing the slides. So here's the agenda here. We're going to start with the legislative response to coronavirus. Holly Wall from Hylant is going to go into some of the health plan changes that are coming. I'll go into the paid leave aspects of this, and then we'll talk about the Senate bill that is, as I said, sounds like it's going to start moving seriously today, and what new provisions are in there. So we'll start with the legislative things before I turn it over to Holly. The third package, as I mentioned, is what's in the works right now. I think it's important, though, that as you think about all the things that have happened, we had the first package on March 6th when $8.3 billion sounded like a lot of money. The package that will likely move through the Senate in the next few days will be closer to $2 trillion with a T, $2 trillion package. The package that moved last week, March 18th, which seems like 5 years ago, that does, if you have less than 500 employees, there are some new requirements that you are going to have to start, or some new option or benefits that you're going to start having to offer to your clients. We're going to get into the details of those later in the presentation. But the government is trying to move as fast as possible. It does seem frustrating how long it's taking for certain things to happen. But hopefully by the end of this week, we'll have that third coronavirus package that, again, will deliver checks in the mail to the majority of Americans, and also will also provide direct economic relief to businesses both over and under 500 lives through forgivable loans that will allow you to continue to pay your employees even through this economic downturn. So Holly, I'll flip through the slides for you, I guess, since that little glitch thing happened. And do you want me to start with this one or go to the next one for you?
Let me see here. I think.
Do you want to take control? Okay, there. Yep, the legislative response to coronavirus. Yep.
Okay.
I think we're all set now.
Okay, so health plan coverage. Are you able to see that one? Because I'm thinking it might not be.
Holly, you should have control now.
Okay, but I don't think it's.
Yes, if you go one more, Holly, I think it'd be exactly where you want to be.
I'll control.
Yeah, it's not.
There we are. We get the right
Okay,
slide up. We're good.
you can see health plan coverage. Perfect. All right. Work from home and lots of stress being on all of our internet infrastructure that we have. So with regard to health plan coverage, dragging it back to coronavirus, as you probably have heard, the bill that James mentioned, the second bill does have a provision for health plan coverage. It states that all health plans, and I'm going to emphasize here, all health plans must cover the COVID-19 testing at 100% with no cost share. So whether you have a self-funded plan, a fully insured plan, small group, large group, doesn't matter, grandfathered status doesn't matter, all health plans must cover the COVID-19 testing at 100%. In addition to the test, also at 100%, must include coverage for either the office visit, urgent care visit, or emergency room visit. An office visit includes a telehealth visit, a virtual visit, that either where the test was administered or the visit that led to the order to get the test. So that must also be covered at 100%. The current bill that passed is silent. It just says it must be covered. It's silent on whether or not it must be covered both in network and out of network. However, the belief seems to be that, you know, certainly the intent was to provide coverage. And because right now these tests are, you know, they're being administered in multiple places, including, you know, tents, in parking lots, pharmacies. So we're thinking that it must be covered on both a network and non-network level. And at least the Senate bill that's out there looks like that would clarify that it must be covered both in network and out of network. Note that you may have seen, interestingly, the IRS bulletin came out before this bill that required the testing be covered at 100%. But the IRS did issue relief for high deductible health plans. You might, you know, recall that if you have a high deductible health plan that allows your employees to contribute to a health savings account, there are only certain services that can be covered before the deductible is met, and that's generally preventive care. However, in this case, the IRS issued a notice saying that a high deductible health plan can cover both testing and treatment for a high deductible health plan, both testing and treatment for the COVID-19 without compromising high deductible health plan status and therefore an individual's ability to contribute to an HSA. That IRS bulletin does not require health plans cover the testing or the treatment. However, if we go, you know, back up to the other bullet, we now have a bill that does require that testing be covered at 100%. There's currently no requirement to cover, so I think there's an echo. I don't know if everyone else, the presenters are on mute. Maybe I'm the only one.
Muted.
Oh, it seemed to get better. Okay, so currently there is no requirement to cover the treatment costs. It will be based on each plan's coverage terms, whether it's deductible and coinsurance, co-pays and so forth. And obviously the treatment costs, is going to be dependent also on, well, is somebody inpatient? Are they, what kind of treatment is being given? So we don't have specific, plan information on how that will be covered because it will be by plan and also be dependent on the treatment that's given. But the main thing to note here is that right now testing must be provided at 100%. On the telehealth front, you heard me mention that for the COVID-19 testing, that includes, must be covered at 100%, including the office visit, which would include a telehealth visit. So any of you that have telehealth or telemedicine, might be familiar that in general, it's not 100% clear, except when you connect the dots. In general, if you have a high deductible health plan, you cannot have, per the regulations, you cannot have be providing telemedicine or telehealth to your employees without a charge to them. So generally, first dollar coverage is not allowed. However, especially with this coronavirus outbreak and a lot of people not wanting to visit their physician if they're sick. So, maybe I have a child who's sick. I don't think it's coronavirus, but they, maybe they've been complaining their ear's been hurting. I think they have an ear infection, but I don't want to drag them to the doctor and expose them to potentially, a lot of other germs that could be there. So there's a big push for employers and in the marketplace to expand the access to telehealth, telemedicine. Currently, the Senate bill that's out there would actually allow high deductible health plans to cover telemedicine and, quote, other remote care services prior to meeting that minimum high deductible in order to be HSA qualified. The Senate bill includes that as an exemption through 2021, so it's not clear what would happen after 2021. The hope is, of course, that that would be continued. And it remains to be seen, if the Senate bill is going to pass as is or what changes will be made. But I did want to make you aware that that is currently something that is being considered, and there is a push to expand telemedicine. That is really it for how the bills currently affect your health plan. So with that, I will turn it back over to James to get into the paid leave provisions.
Sure. And Lisa, you want to just drive the slides here, or you want me to? Looks like Lisa's going to do it. She's well equipped.
I'll drive.
Yeah. So if you go to the next slide, perfect. If you go to the next slide, yeah. So there's two provisions that we're going to talk about. There's the new mandated paid sick leave, and there's the new emergency paid FMLA. And the first thing that's important is if you have more than 500 employees. Well, let me take a step back. If you're a private employer and you have more than 500 employees, neither of what I'm about to talk about applies to you. Now, we get other stuff later in the presentation that applies to you. But if you have more than 500 employees, the definition of employees under that FLSA definition, so it's pretty broad. If you have 500 employees or more, neither of these things apply. However, if you have less than 500 employees, these things do apply, and you have 15 days from March 18th, which, what is that, April 3rd or 4th? 15 days from March 18th to comply with both of the provisions that we're going to talk about. If you're a public employer, so you're a government employee, or you're a government administrator, you run benefits for a government employer, this applies to you. The mandated paid sick leave applies to you. We'll talk to FMLA and when we get there. The new requirement is you must provide 80 hours of paid sick leave to your full-time employees for COVID-19 reasons, which we'll talk about the reasons in a minute. And for your part-time employees, it's the average numbers of hours that they've worked over the past 2 weeks. So we're going to have to, if you're under 500 lives, you're going to have to provide this paid sick leave for COVID-19 reasons within 15 days of March 18th, which again, I wish I should have this written down. April 3rd, which would be April 3rd or April 4th. Lisa, if you can go to the next slide. And so the reasons that you're going to be able to use this mandated paid sick leave, there's a couple of them, or excuse me, the 6 reasons, and we'll talk about how much the payment is, but it's important to note which reason your employee is using, because it is going to drive what you're required to pay that employee. Now, what's also important is words matter in legislative language. And so this mandated paid sick leave can only be used by your employee if they can't work or telework. Okay? So just because I can't go into the office doesn't necessarily mean I'm going to have access to these if I can still telework and do my job. And as you can see here, there's 6 different reasons that you're able to access this paid leave. So the first 3 on the left apply to yourself. So you're subject to a quarantine or isolation order. You've been advised that you need to self-quarantine because by a healthcare provider, or you're experiencing symptoms, and you need to seek medical assistance. If you qualify for one of those 3 purposes and you can't work or telework, that's caring for yourself. Caring for yourself matters. We'll talk about that why in a moment. Additionally, if you're unable to work or telework and you're caring for someone that has one of these orders or has been advised to quarantine, if your kid, school is closed or their healthcare or their daycare center is closed, and because of that you can't work or telework, you're also eligible for these 10 up to 10 paid sick days. And then there's sort of a catch-all, more broad if you're experiencing something else that's specified by the governor. Now, I had a question yesterday about Ohio, but it's not just Ohio. There's I think now 12 states that have, could be more, at least 12 states that have some type of stay-at-home order. See that the first bullet there is the stay-at-home order in Ohio or Massachusetts, where I'm living, or New Hampshire, or Connecticut, or Illinois. Do those qualify as a federal, state, or local quarantine or isolation order? Now, remember, the order that you have in Ohio, just like I have in Massachusetts, is that non-essential employees are not supposed to go to work. That is the way that we are interpreting that at this moment, is that is not a quarantine or isolation order. However, what we have done is we have reached out to congressional staff on the Ways and Means Committee, the committee where a lot of this work was done, and we've specifically asked them, do these orders that the states are putting out, which really aren't quarantine or isolation orders, but are non-essential businesses can't have their workers come in, do those qualify? Hopefully we'll get that answer today or tomorrow, but that is an open question as to whether these orders that are going out, does that qualify for that first bullet on the left. Lisa, if you can go to the next slide. The reason why we separated the self-care versus care for others is, as you can see, if you're caring for yourself, it's going to be up to $511 a day. So as an employer, you're going to be responsible for paying basically normal wages up to $511 a day. So there's a cap. If I'm caring for others, well, that means you as the employer are only required to pay me $200 per day. So my regular wages up to $200 per day. So there's different levels of what you're required as an employer to provide, depending on the size, but depending on what reason your employee is using these COVID-19 paid sick days, which again, provide up to 80 hours, 10 days of paid sick leave. So that's why you can see the aggregate. So obviously 511 times 10 is 5110. So that's why you see those maximums there. What we are still awaiting further clarity on is exactly how the reimbursement mechanism is going to work for you as the employer. So you are now you are now required to provide the numbers above, the $511 or the $200 per day, but the government wants you to not have to pay for this. They're just using you as the mechanism to get the money to the employees. At one point in the negotiations, Social Security was going to handle this, but the thought was you as the employer have the quickest and best way to provide your employees with continuing income, and so you will make the payments. However, the government wants to make sure that you actually don't pay for the payments that you're putting out. And so they feel that the quickest way to do this is to create a new payroll tax credit that 100% reimburses you for any amounts that you've paid. Now, before I went on this call, I've been checking every day. Went to the Department of Labor website, went to the notice. There was a notice that went out Friday. Friday's notice said, hey, we're going to have a lot more, paraphrasing, we're going to have a lot more information about how the paid sick leave and the paid FMLA, which we'll talk about in a minute, are going to operate. In addition, we're going to have more clarity over how employers are going to be able to get immediate reimbursement through these payroll tax credits. But as of at least 20 minutes ago, when I checked the website, that information has not been updated. However, what I could find is that it does look like the Social Security payroll taxes that you currently collect from your employees and then send to the federal government, it looks like while you won't necessarily have to do that, you'll have to collect them and allocate them somewhere, but you won't necessarily have to send them to the federal government. And there'll be some immediate tax credit. You'll be able to essentially hold on to that, the collection of those Social Security payroll taxes, to offset the costs of paying the employee. I know, it seems confusing. It's not clear how the mechanism would work. It's also possible that in the Senate bill that comes out today, there'll be maybe even different mechanism to make sure that you're getting reimbursed, because Secretary Mnuchin in particular is very concerned about putting any additional burden on employers right now. And clearly, if you have to make this payment to the employee, there's a burden on you, and wants to make sure that there's immediate freed up cash flow and reimbursement from the federal government. Easier said than done. Again, the regulations on that have, at least, unless they were released 10 minutes ago, or Holly, you might have better information than me. But when I just went to the website, it wasn't there. And we have been directed that as soon as those regulations are published, they'll be published to the Department of Labor website. Lisa, if you can go to the next slide. There is an exemption if you have less than 50 employees. This exemption is misunderstood, and quite frankly, was very misunderstood by me when the law first came out. The exemption only applies to you 50 employers that you can decide you don't. Let me say it differently. You can apply for an exemption to not provide paid sick leave only in the situation where your employee has a kid's school that's closed or daycare center that's closed and they cannot work or telework. So if you decide, if you have less than 50 employees and you're on the phone, if you decide that offering that, just that particular piece of the paid sick leave is going to create, and you see the words there in italics, this is the exact word from the legislation, an imposition that would jeopardize the viability of your business, you are going to be able to apply to the Department of Labor to get an exemption from providing just that paid sick leave. So you'll still have to provide the other reasons of paid sick leave, but you can apply for an exemption just for that one. What's the exemption process? Don't have it yet. Again, Department of Labor, we'll assume very, very quickly is going to get this out. Remember, you have up to 15 days to comply with this from March 18th, 15 days from March 18th. So again, I haven't seen that process yet. Holly, if you have, chime in. But again, we've been told the Department of Labor is working on that as quickly as they can, and that exemption should be, and that process should be released shortly. All that being said, if you have less than 50 employees and you feel like offering just that bullet for the sick leave, all the other sick leave reasons you're going to have to provide, if you feel like that is going to jeopardize the viability of your business, I would start in writing, creating a little paragraph, bullet points of why that would jeopardize the viability of your business. And again, eventually we'll know the process and how you're going to submit it. But if you want, you might as well spend 10 minutes and put that little, bullet points together that you'll have to use for submission. This is on conversation that I've had with congressional staff. The thought process is, if you apply for this exemption, they're going to err on the side of providing it to you. It's not going to be rubber stamped. But again, if it's they want to err on the side of trying to protect businesses from going under, and if this would again jeopardize the viability of the business, they want to provide that exemption. Again, I'm not trying to hammer this too much, but originally it was thought that this U50 exemption was for the entire paid sick leave law. It's not. It's just for that one reason. Can I tell you why? No. Things got changed like 50 times in between March 15th and March 17th. The bill actually went through this huge technical correction, which was like unbelievable. Democrats, Republicans worked really hard to get, you can imagine how difficult it is to get a mandatory paid sick leave law through. And this is where they landed. Should it apply to employers that have more than 500 lives? Maybe. Does it? No. Why? Because that's the way the bill was negotiated. And the only way they could get it through was to just have it narrowly tailored. Lisa, if you go to the next slide, on paid family and emergency paid FMLA, this gets a little crazy here. So if you're under 50 lives, you don't deal with FMLA. Well, this provision applies to you. We'll talk about that in a minute. This applies to all private employers under 500 lives. And actually, that's my mistake in the slide. It applies to all employers under 500 lives. So if you are a public employer and you have less than 500 lives, this also applies to you. Now, not to confuse everyone, there's a little summary that will go through this. If you're a public employer with over 500 lives, this does not apply to you. But if you're a private or public employer under 500 lives, it applies. This is going to require you to provide 10 weeks of paid FMLA. Now, it's not paid FMLA for everything. It's just for COVID-19 purposes. And in fact, it's only for one purpose. It's 10 weeks of paid FMLA. It's actually, and again, these are my slides. I should have said this differently. It's 12 weeks of FMLA. 10 of those weeks are paid. And the only reason you can use this provision of FMLA is if your kid school is closed and you can't work or telework because of that. That's it. A lot of criticism on this part of the bill of saying, wait a minute. So I get COVID-19 and I'm really sick. I get 10 paid sick days because I'm sick from COVID-19. Yes. Then on day 11, paid FMLA doesn't apply. That's correct. I'm sick with COVID-19. Emergency paid FMLA does not apply to me. The only reason, again, not saying it's right or wrong. I just read the laws. I'm just a reporter. I'm not the writer. The only reason that this law applies is if your child's school, son or daughter's school is canceled because of COVID-19 reasons, and you can't work or telework. Lisa, if you go to the next slide. And so that's reflected in the amount of money that you're going to receive. So remember, just like if it's the paid sick leave and you're caring for someone else, you only get $200 a day. Similarly, for the emergency paid FMLA, you will only receive the $200 a day for the 10 weeks. This is not an additional FMLA either. So in other words, it is now, that's March, so it's early in the year. But let's say that I was on January 1st, I was in a car accident, or my wife had a baby, and she went out on regular FMLA, or I went out on regular MLA, or pre-COVID-19 FMLA, and I've used up all my 12 weeks. Am I now eligible for this emergency paid FMLA? No. It is just another FMLA reason. It is not an additional FMLA. It's not a plus sitting on top of it. So another way to think of this too, if you use the emergency paid FMLA and later on in the year you have a baby and you want to go out on regular FMLA, you will not have the regular FMLA time. I'm not saying that's the right, the wrong, that maybe it's changed in the future, but that's the way the law was written. It is what it is. The same thing applies here. Employer tax credit. There's some not 100% entirely clear immediate tax credit that you receive that offsets the payments for these. And similarly to paid sick leave, there's a U50 exemption. The U50 exemption for paid sick leave is the same as the U50 exemption for paid FMLA, because there's only one reason in paid FMLA. It's if you feel like providing this leave for someone when their kid's school's closed is going to jeopardize the viability of the business, then you can apply for an exemption. Again, that exemption process, at least 20 minutes ago, I did not see I've not seen that process released at this point. Lisa, if you go to the next slide. So this was my attempt at summarizing what's required depending on what size you're at. So again, if you're over 500 employees, no problem. You got nothing to worry about. You got a ton to worry about. I get that, but for these new provisions, they don't apply. Probably a better way to say it. If you're any employer, under 500 lives, the emergency paid FMLA is going to apply. So whether you're a private employer, public employer, under 500 lives, emergency paid FMLA. And then if you're under 500 employees, or you're a public employer of any size, the paid sick leave time is going to apply to you. This slide, I would argue, for me, is the most valuable because it's really hard to keep all these things just figured out. And this doesn't go into the details, but again, you can figure out who you are on the slide, and then you can see what applies to you. Again, if you're the U50 employer, you got an opportunity to apply for an exemption in some situations, but generally speaking, this is what's going to apply. So Lisa, if you go to the next slide. So that's law today. Been in effect since March 18th. You have 15 days from March 18th to apply for that. What are some things that are coming next? So the Senate bill right now that at least I haven't seen the language. When we get off, we'll be able to look at the language. In there, there's likely not going to be an expansion of paid leave. Democrats would like to. If you look at the 1,400-page bill Speaker Pelosi released yesterday, there are some expansions to both paid sick leave and paid FMLA. That bill, really more of a show bill than anything else. The Senate bill is what we want to pay attention to. For some point in the future, though, when we're all back to normal, whatever that is, there is no question that the dynamics of paid family and medical leave in America have changed because of COVID-19. And it is likely when we get through this, one of the top priorities for Democrats and some Republicans will be to expand FMLA, potentially to paid FMLA, and also there'll be more states looking to expand paid family and medical leave. As you know, today there's 9 states, 8 states in DC that have requirements in place. It's likely those, that will increase in the future. The one criticism you hear about the House bill certainly is, why are large employers exempted over 500 lives. We had a very tough conversation with a Ascent staffer 2 weeks ago when they were going through the different, or it was a week ago. Everything seems like 2 weeks ago, but probably was like yesterday. When they asked us, so at Sun Life, you guys are great. We have this amazing paid family medical leave program. They asked us, so if you had someone that couldn't work for 10 weeks because their kid's school was closed for whatever reason, would you continue to pay them? And we were like, to be honest, we're like, well, no, like our policy never contemplated quarantines or kids' schools closing for 10 weeks because of diseases. So yeah, we have more than 500 lives, and no, we don't have that benefit. And it was almost like a lightning, like a light bulb went off in some of these staffers' heads. They're like, well, do you think most employers over 500 lives don't have that? And we're like, yes, there's probably no employer today that has a policy that says if your kid's school is closed for 10 weeks because of a, natural disease, you're going to still get paid. So there's a lot of, by the way, what we're doing is on a case-by-case basis trying to figure it out, but we're 100% telework now. So it's, we're in relatively good shape. I mean, my kids are home right now. You don't even know I'm still working, but there's definitely a lot of criticism that employers over 500 lives are exempted from this. And also, as we mentioned, I get sick from COVID-19. After 10 days, there's nothing that's going to pay me so far. Lisa, if you go to the next slide, what we're watching very closely is the CARES Act. Again, literally when I get off this call, I got to do all kinds of work to see what the new legislative language says. This is what probably is going to look like. These are the checks that people have been talking about. Won't really be checks. They'll be direct deposited. But $1,200 for single folks, $2,400 for married. Again, these are my slides, so I probably should have. They're not taxpayer. It looks like, at least in the last version of the language that I saw, they're not worried about if you pay taxes. They're worried about if you're here if you're in the country undocumented or not. And if you're I don't know how to say all these things right, but if you're here, if you're not undocumented, if you're here legally, you'd be eligible for these payments. $1,200 per taxpayer, $2,400 for married couple, $500 per child. At least the version that I saw, there was no max on the number of kids. But there's phase outs. And again, we'll have to see what the exact numbers are. But basically, if you make more than 100 grand, you're single, or 200,000, you're married, you're not going to be eligible for these. What I'm very unclear on is how they're going to determine what those numbers are. Because remember, your 2019 taxes, you haven't filed, and you don't have to now till July 15th. So that's not a good proxy, your 2019 tax returns. And your 2018 tax returns, like that was a long time ago, and a lot of stuff has changed. But there is and so we'll have to see what the final language is, but there's a real desire to get money to people that need it, and people who, using air quotes, don't need it or don't need it as much, probably a better way to say it, not get the money to them. That said, I could make $200,000, and I was laid off 2 weeks ago because my company, is closing, because of COVID-19. So again, not judging, not saying it's right, not saying it's wrong, but money into the pockets of people that need it the most, and phasing out that amount for people that don't. Now, again, I haven't seen the language that was negotiated last night, but that'll be coming out very soon. Lisa, if you go to the next slide. For businesses out, is there one other slide? Can you go one? All right. Okay. Go back. No problem. Go back to the 2 more slides. Sorry, Lisa. One more. Okay. 2 other things that aren't here on the slide. My fault. But is important for business owners. So again, you have less than 500 employees, particularly important for less than 500 employees. The last version of the bill looks like it's probably going to be the same in this version based on just some of the chatter back and forth. You're going to be eligible for up to $10 million of loans to help you continue to pay for things like rent, utility, and your employees' salaries. Now, the way that these will work is to be eligible for these loans. And again, once the final language is out, we'll put something together. I'm sure, Highland will as well for you. You'll be eligible for these loans as long as you keep your payroll steady. So in other words, I have a pizza shop. It's a pizza chain, big pizza chain. We got 100 employees. It's unbelievable. But I'm in trouble. No one's ordering pizza right now. So actually, probably a lot of people are ordering pizza, but I have a hair salon chain. Better. I'm forced to be closed. I'm a non-essential business. I got 100 employees. I'm going to be able to apply for a loan, which I believe is going to provide me with up to 1 year looking back of salaries, utilities, rent payments, those type of things. Get that immediately to me. The reason I can get this loan is if I agree to keep my payroll at the same level. In other words, I agree that I'm not going to lay off workers. And if I agree not to lay off workers, the government's going to provide me with money to continue to pay their salaries, even if potentially I'm not able to keep my business open. If I've already laid off employees, and I'm almost 100% certain this provision will be in the language that comes out today as well. If I've already laid off employees, I'm going to have a window of time to rehire them. Once I rehire them, I will then be able to apply and get the loan. So again, these loans, they're being called a lot of different things. They would stabilize your cash flow and make it possible for you to continue to pay your employees, even if your business no longer has money coming in. The idea, though, is let's keep people off unemployment. Let's keep people employed. Items that we're fighting for right now, my day job, I'm a lobbyist, is when you take these loans, we want to make sure that you can use them to pay for your employees' health insurance premiums, to pay for their dental insurance premiums, all the benefits that you offer today, maybe 401k contributions, stuff like that. The devil will be in the details, and we'll see. We'll see when that comes out. But that's going to be for under 5. They'll be targeted for businesses that have less than 500 employees. That's probably going to be $500 billion will be in that pool. There's likely to be another $500 billion pool that's for businesses that have over 500 employees. Of that $500 billion, probably $100 billion of it will be specifically allocated to the airlines industries, industries that are directly related to the security of the country, and I think cargo industries as well. So like not air, like UPS, those type of things as well. And so again, $500 billion for the larger corporations, about $100 billion allocated for specific industries. Don't call it a bailout. Nobody wants to call it a bailout. And then another $400 billion for, again, larger companies, but that aren't necessarily in those categories. The real hang-up in the legislation the last day or so, and why you saw the procedural vote fail yesterday, was over who's going to have control over that larger. The Small Business Association is going to run the $500 billion that we talked about a minute ago. For this larger business, $500 billion, the original language was Secretary Mnuchin would essentially, in Treasury, would have basically direct authority over this $500 billion. Democrats didn't like that. If you remember back to TARP in 2008, there was a lot of oversight over what companies were getting it, when they were expected to pay money back, what they had to do, et cetera, et cetera. And there's going to be strict requirements on businesses. We'll have to see if there's going to be restrictions on buybacks, restrictions on layoffs, other things as well. But again, so there's going to be immediate relief that could be out there. For small businesses, the timing, I believe they're going to try to get that process to apply for the loans within 48 hours. The Small Business Association is working, obviously, or Small Business Administration is working very hard on that. The other thing that would be in there, and again, there'll be more employer provisions. It's very possible that for employer payroll taxes, you would not be required to send the payroll taxes that you collect from your employees to the federal government until 2021. So again, we'll have to see if that provision's in there. But again, the idea would be that kind of gives you an interest-free loan where you collect the payroll taxes, you use them for what you need them for, and at some point in 2021, you got to pay the government those. Social Security would be held harmless for that. The federal government would pay the interest. There wouldn't be any interest there. Also, I should have mentioned, for the small business loans, it's likely that if you take the loan, again, the requirement's going to be you don't lay anybody off, or you keep your payroll relatively steady. It's very likely there's going to be a provision in those loans. This is for the small businesses, that if you do keep your payroll straight, keep your payroll at the same level, don't lay people off, those loans will be forgiven. So it's that's not a bad deal. So again, we'll have devils in the details, but it does feel like there will be forgivable loans available to businesses under 500 lives if you keep your employees on the payroll throughout a certain period of time. Don't have the language yet, but again, there's a lot of hard work on relief out there. Slide you have there in front of you. There's just issues right now in Congress. There's 5 senators that are unavailable right now. 4 of the 5 are quarantined. Senator Paul, of course, has as COVID-19. Does change the dynamics in Congress because instead of a 53-47 majority for the Republicans, it's a 48-47 majority for the Republicans. Makes it tougher. There's no remote voting in the House or the Senate. I mean, again, Sun Life, 100% of our employees are telecommuting right now. The people that are processing your claims, the people that are writing your checks, like 100% of people are telecommuting. Congress, 0% can telecommute. There's no way to virtual vote. And for whatever reason, members are very hesitant to make changes. There's some questions about the constitutionality of it, but that's for different time, different day. So it's a little bit narrow right now with those Republicans not there. It just makes it harder for Republicans to move stuff because they need basically every Republican, and they need to get Democrats, on board as well. Lisa, if you go to the next slide, where I'm almost done here. So this is what we got to watch. If this bill moves in the Senate, I think the next time they can do a procedural vote would be late this evening, early tomorrow. Probably the bill itself can't pass until Wednesday just because of ridiculous procedures, unless there's unanimous consent, meaning every single senator, all 95, agree with 100% of the language. You would hope that maybe there is. Without unanimous consent, it's probably a day until the legislation can be passed. From there, the next piece of the puzzle is the House has to pass the legislation. Right now, the House is at home. They're all in recess. So the members that live in California are in California, most of them. So they have to fly back to D.C. because there is no remote voting. House Rules Committee released a white paper yesterday basically saying we can't figure out how to do remote voting because we don't know if it's constitutional or not. So the members are likely going to have to, House members are going to have to come back, vote. And then again, if the House doesn't take exactly the same language the Senate has passed, it has to go back to the Senate. So if you remember the bill that passed on March 18th, the House passed it. Then they made some technical corrections. Forget about that. Then the Senate took the exact bill, didn't make any changes. You'd need to have the exact same thing happen on this bill. Senate passes it, House takes it without any changes. So probably the earliest we're seeing this bill on President Trump's desk is Friday. That's very optimistic. Today's Tuesday still? Yeah, Tuesday, Wednesday. Yeah, I'd say Friday's probably, maybe Herculean things can happen and it's Thursday. But again, House members have to come back. We have a couple good relationships with members across the country. And at this point, I know that their staffs are preparing for them to fly back to DC, but they have not been formally called back to DC at this point. So at least if you go to the next slide. Okay, so that's where we're at. Holly, I think, gave a great view of sort of the healthcare stuff that's happening. I talked about the paid leave and some other things that are coming down the road. Obviously, any questions that you have, we're happy to take. We probably won't have all the answers, but we'll have some, and we can certainly try to get the answers that we don't have.
Yeah, James, thank you very much. And there was a slide that was inadvertently left from the slide deck, which we will include in the handouts that will be available on Hylant.com. In addition, we have some great questions, and we will get through as many as we can, but recognizing in the interest of time, we will also create a Q&A supplement to go along with these questions, because a lot of there are, I think, questions that will be viable in our effort to kind of hit the high level on this. We'll be able to provide these Q&As on an after basis. So I will moderate the Q&A and allow Holly and James to answer as they see appropriate. So the first question, and I don't know that we have an answer to this because it's going to vary, but during the shelter-in-place order, do employees laid off still get to keep their health insurance?
I'll take that one as it relates to health plans. And I'm going to say that is going to vary widely based on each employer and what's in the plan document and what's in the the plan materials, depending on whether you're self-funded or fully insured, and what kind of leave or layoff provisions are in your plan. Some carriers are coming out and stating that they will allow employers to extend benefits for a period of time. From what I've seen, that is on states giving employers, the State Department of Insurance giving employers that option. I haven't seen anything that requires employers to extend coverage to this point. I do want to mention, though, for those employers that are considered applicable large employers under the Affordable Care Act, to keep in mind as you are determining whether to do layoffs or furloughs, reductions in hours, and so forth, that if you are subject to the pay or play mandate, your applicable large employer, and if you are using the look back measurement method to determine your employee's full-time status, that if you have employees who have been deemed full-time for a stability period, and they're in that stability period, even if you reduce their hours or lay them off, drop their hours down to 0, they're still considered an ACA full-time employee throughout that stability period. So, so keep that in mind. If you have that situation, certainly reach out to your Hylant representative, and we can talk through options with you. However, I can't give a blanket answer on when coverage will end or how long it will be extended, is that's going to be very much determined on a health plan by health plan basis.
Great. Thanks, Holly. Next question. If we are self-funded and a member goes to the emergency room for COVID-19 symptoms, will we have to cover the entire emergency room visit?
That's a very good question. The way I understand the bill right now, and keep in mind that as additional bills get passed, this could change. But as it stands right now, the language in the bill that was passed and signed into law requires that the health plan would cover I'm just going to use the emergency room visit only if it either results in an order for a COVID test, or if there is administration of the COVID test, and only to the extent of the emergency room visit that was regarding that COVID test. So a real life example, if I go to the emergency room and I have COVID symptoms, or I think I have COVID symptoms, yet the emergency room tests me and I have the regular flu or whatever, that would not be included because it did not result in me getting a test or having the test administered. On the other hand, if I go to the emergency room and the emergency room orders that I have a test, and I go to, and let's just say I go to the tent at my local Walgreens parking lot to get the test, then both the emergency room visit and the test administered in the Walgreens parking lot would have to be covered at 100%. If also, and this is kind of a stretch for an ER visit, but let's use a doctor's office visit as an example. If I go to the doctor and my doctor orders a COVID test for me, and while I'm there, I also say, oh, and by the way, I've been having some, actually, I'm going to use an urgent care example. I go to the urgent care center with COVID symptoms, they do a COVID test, and I also say, oh, and by the way, I sprained my ankle the other day. So they give me x-rays on the site, like a lot of urgent care centers can do. That portion of the visit that's not related to the COVID test is not subject to the requirement to cover at 100%. So the normal health plan terms would apply in that situation.
Great, thanks, Holly. Next question. Does the Senate bill require high deductible health plans to cover telehealth at 100%, or is it just made allowable to cover at 100%?
My understanding of the Senate bill in the most recent form that I've looked at, it simply provides an exemption of a service that can be covered at 100% without jeopardizing status. So it does not require it.
Thank you.
As it stands right now.
Great. Next question. Does the 500 life count for only U.S. employees? For example, if we are an employer that has 500 employees, including Canadian or other employees in other countries, but less than 500 in the U.S., does this leave requirement, paid leave requirement, apply to us?
I would have to go back and look at the FLSA definition, but I'm going to we'll confirm this, but I believe it's only going to apply to your U.S., for your total U.S. employee number. In other words, if you had, in your example, if you had the Canadian number that pushes you over 500, that would not make it apply, but I will confirm that.
We'll have a couple like that, James. Another question that says, what about a consolidated U.S. entity? Is this based on consolidated entity level?
Yeah, that's a pretty technical question. From what we have, I know I was on a different call internally, and we believed it was based on it will be based on the entire consolidated employer's number, but I have an answer to that somewhere that I can send over to you.
Great. We'll make sure we have that in the Q&A. Thank you. Moving on, another question. Mandated paid sick leave. Are employees required to tell the employer they or a family member has COVID-19?
There are notification requirements. Man, Holly just answers all our questions, no problem. Not me. I don't.
I missed it. Can you repeat that question? I missed the first part of it.
Sorry, I was muted. Under the paid sick leave, are employees required to tell their employer that they have COVID-19? I'm not sure how they get the paid sick leave if they've not given the reason, but I'm not sure.
I will add. Yeah.
Go ahead.
Well, I was so while you're looking, because I don't have the answer to it as it relates to the paid sick leave requirement. However, I will just add a little color commentary that under HIPAA privacy, HIPAA privacy does allow healthcare providers, so the doctors, the nurses, the labs, to notify others in the event, and I don't have the language in front of me, but it does allow call it release of the private information, or to notify others in the event of, preventing severe illness, or, something to that effect. So I actually think, and I don't know this, it's been tested, but I believe that in many cases, we may find that the healthcare providers, if I go in and I test positive for COVID, they may say, okay, Holly, I need to know, do you go to school? What school do you go to? Are you employed? Who's your employer? Some of those things. And they may be notifying those entities. So that's just some color commentary on that. But as far as
Holly bought
the
me a little time, which was, thank you for buying me that time.
All right.
So I just went back, I went back through the language of the legislation, and it actually, there's no, we're going to have to wait for regulations to come out, because there isn't a process defined of how you notify your employer of why you're going to be out. And unfortunately, you need to tell the employer why you're going to be out, under which reason, because that then figures out what the employer is going to have to pay. I mean, so, and that is, I went through the whole thing. It's not defined at this point. However, we'll probably know within 7 days of March 18th, because the Department of Labor has 7 days for you as the employer to create a notice that you have to post, like all those things you have to post, of what the language needs to be. So, maybe it's within, so what's 7 days from March? So by March 25th, so that's tomorrow. Maybe by tomorrow we'll have the process of how you notify the employer, but the law is not. It does not provide that. That does not provide that.
There are a few questions regarding the 500 lives, but we're going to skip those, and we will clarify those in a future Q&A. Another question that's come, how does, this is a little tough to, will you explain, does intermittent count, or is it only if someone cannot work at all?
It's not intermittent. And Holly, you can correct me if I'm wrong, but from what we understand, it has to be used altogether.
Yeah, and I have not, focused on that part of it. So James, I'm going to rely on you.
Yeah, I mean, I'm just looking here. There is no intermittent leave for this. It has to be used and used all at once.
Great, thank you. is there any requirement, what is the requirement for physician documentation to qualify? Or is there?
It's a similar, it hasn't, so let me give you an example. So one of the reasons is the employee has been advised by a healthcare provider to self-quarantine due to concerns. Clearly, there's going to need to be some type of documentation that shows that the healthcare, what the healthcare provider has provided, but that has the regulations for this have not been drafted. It's very rare that you have a law that can immediately go into effect, that immediately goes into effect, that, because it takes some time, for the regulations to come out. That's not the case here. So again, the Department of Labor has to create the regulations. It's a crappy answer. I'm not trying to, hide it, but it's at this point, that has not been spelled out.
Great. We do have a number of questions, but the one that has been asked a few times is, can you clarify the two-thirds of pay up to 200? Maybe there are questions about for the paid sick leave. Are there some scenarios where it's 2/3 of pay and somewhere it's 100% of pay?
Yeah, so I'm going to look at this. I just stole the screen from you, Lisa. How about that?
Perfect.
And yep. So, okay. If you're on the left-hand side of the screen, you're the 2/3 to 511. If you're the two bullets on the right-hand side of the, or if you're, don't worry about the sixth bullet. That's like a weird thing that's never going to happen. If you're on the first three bullets on the left side of the screen, you're 511. If you're the second two bullets, you're 200. So it's really the defining thing is self-care or care of others. I'm going to be capped at $200 a day.
One question was, if the business is deemed an
exemption that I didn't talk about, fighter or emergency responder, you can actually, there's no exemption. You can deny the employee these benefits. We aren't, but here in Massachusetts and in other states, Sun Life, there is no exemption in these laws for a special carve out for healthcare providers or emergency responders. The Senate exemption for essential employers is not, or emergency responders, which is tough. I mean, you could argue they're the ones that might need the most, but that's just the way it's being, that's just the way the law was drafted.
This will be our last question, and then we'll close, and we'll, as I said, do a Q&A for the rest. A couple of folks have asked about if they are going to be more generous than what is required. Is there still potential for relief on the payroll tax credit up to the amount described?
Okay, so let me just say this back. So my regular wages would be, I'm sick myself. My regular wages are $300, but my employer wants to give me the full $511. Do I get the employer tax credit? And unfortunately, the way the law reads, it's the 2/3 salary up to the maximum.
I think the question might. Yeah, I think the question might be the opposite.
Sorry.
So I would make more than is provided, generally should make more than the 2/3, more than is what's provided here. Would I still get the tax credit for up to the eligible amount?
Yes. Oh, I'm sorry. Thank you, Lisa, very much. So I make $600. I get my employer, my employer gives me $600. They say, we're just going to give you your 100%. They would be eligible up to $511 of the tax credit. So the maximum amount of tax credit you can get is $511, but you can certainly go over and above that amount. You just won't be provided any additional tax relief.
Great. Thank you, James.
Was that the, okay.
Yeah, I think that answered the question. We have a lot of additional questions, which have been great. I know that this is an incredibly confusing time, and there's still a lot of details to be worked out and logistics to be worked out. So, with that, we will continue to keep you up to date. We will continue to have webinar presentations as things develop. For today, I want to thank you so much, James and Holly, for this enlightening presentation. Again, there are further questions that we didn't get answered today. You can feel free to contact a Hylant client executive or another member of a local service team to answer more questions, but we are going to create a complete Q&A that we'll have available on Hylant.com along with the slides and the recorded webinar after this presentation. Again, thank you to our presenters and thank everyone who attended today. Everyone, please stay safe and healthy, and we look to provide more information in the coming days. James and Holly, thank you so much, and thanks everyone for attending.
Thank you.
Thank you. Take care.